Yeah, I'm looking forward to doing this presentation on the grit and resiliency. I think one of the big hot topics that that we deal with all the time here at OPHP, and when we go speak at hospitals, is the challenge of stress and burnout, and how people are just feeling overwhelmed in their work conditions, and what are ways that we can address this issue. And part of it's maybe talking about how do I bounce back from kind of these adversities, and how do I develop kind of stick-to-itiveness, I guess. And so I think we're going to just spend some time talking about, I put the values of grit and resiliency. I think I got the wrong title. I mean, the virtues of grit and resiliency, but we're going to talk about those two components. And, we'll have a couple of video clips, just kind of talk about some things, and then kind of, get some information, some quotes from some of the leading researchers about, grit and resiliency, and talk about ways that people develop grit and resiliency. So that's kind of like the focus of this, is to kind of like look at them. What do these topics mean, and how are they evolved, and what are the skills that people use to create them, and to be able to utilize them better in their personal and professional life. So I think we'll just take them one at a time. We'll start first with the grit, and talk about that. Grit's this what it is, at least kind of as far as the definition, is the courage and resolve or strength of character to be able to stick with something. Even, I think of the word grit itself. I mean, it's just like, it's a tough word. We think of the movie maybe with John Wayne, or they did the remake of it. I think Jeff Bridges played this character, that sheriff, that it's just gritty, just tough, had an eye patch, and that's kind of what grit is just this toughness, this ability to stick with something, despite whatever's kind of being thrown at you, and the challenges. And so it talks about really those two main concepts of grit, which is that perseverance of effort, just the ability to just continue to stick and give effort and energy to something, and the consistency of effort. So this idea that it's not just something that's fleeting, but I consistently trying to stick with whatever it is I'm trying to get through or accomplish, and it takes perseverance, because there is this, at times it's going to be really challenging and difficult. But developing and understanding grit, you can bring a lot of success. In fact, one of the slides we'll talk about probably on the next slide talks about where grit sometimes is a better predictor of success than even like cognitive ability. So there's 5 characteristics of grit, right? There's courage, conscientiousness, follow through, resilience, which we'll spend obviously the second half of this presentation just discussing what resilience is, and then excellence versus perfection. And I think that was a point when we talked about these 5 characteristics as the one to really kind of sit and focus on for a couple seconds. There's a huge difference for striving for excellence and being stuck in perfectionism. And I say the word being stuck in perfectionism because I sometimes find perfectionism to being kind of a pathology, or a roadblock to people's wellness. I work with a lot of healthcare professionals, and they're always striving for excellence, or for the best. But sometimes they get stuck on trying to strive not only for the best, but for something to be perfect. And the reality is, perfection, it's not that it doesn't really exist, in the sense that I don't think that when we're stuck in perfectionism, we'll ever be fully satisfied for what we want, where we're trying to achieve. So what we're trying to talk about here is learning more about being able to strive for excellence, trying to be able to get to a goal or somewhere where I want to go, where I'm feeling satisfied, I'm moving forward, I'm making progress, and allow me to be able to stick with it and to get the best right I can, but also allow me to be able to say, okay, I've gotten to a place of success. Now I can try to move on and go to other goals, instead of having this perfectionism keep me stuck, keep me pushing, and never being satisfied. And I think one of the things about grit is being able to feel satisfied. And also, perfectionism can have that opposite effect too, where I see, I'm striving for perfection and I can't get to it, I kind of give up. If I can't get perfect, I won't try. And then we lose some of that, ability to achieve. So we'll talk a little bit more about grit. So Angela Lee Duckworth, she's a psychologist, and she's kind of the leading researcher on grit. And I think I've actually included in the resource, I think her TED Talk, if I have it, I think it is connected to like the last resource, or where you can see, and she actually has an 8-point questionnaire about grittiness that everybody can take if they want to, and gets their hands on the resources and puts them on the website. But she says, grit is often an ignored psychological trait that can help explain why some individuals succeed when others with equal or greater ability do not. And I think everybody here has probably seen that, or maybe even personally experienced it, where you've been able to achieve with less when people have had more. And what is it that allows somebody to get somewhere when you see somebody else has all the tools and all the things laid out in front of them that they don't do it? And so one of the things that we kind of discover is that grit is what allows people to do that, ability to stick with it, to go through something complicated and to get to the other side, even when there's challenges in front of them and even when the path isn't smooth. I'm sure many of you did that through medical school, or were able to find that and use grit to be successful in doing that. And then she also writes that grit is not just resilience in the face of failure, but also having the deep commitments to remain loyal to something to over many years. And the idea is like, grit is not just getting through something, but it's sticking with something. And we talked about in that previous slide is that it's not just about getting through it, but it's being consistent and being willing to put the effort in, even when it's challenging, not giving up. And that's what really develops that grit, that toughness to persevere. It said there, I was looking at some of her research, and she indicated that grit is a better predictor of long-term success than even cognitive ability. And I know I said that previously, but I think about that. It's like sometimes it's not always about what's the best score. It's about my willingness to commit, and to take on challenges. And I think some of you probably have had personal experience where you've done that, or know people who have gone through that they have gotten success, not necessarily because they always had the best skills, but they had the most determination. So one of the things that we talked about, and I found an article that talked about grit and how do you grow it. It pointed out 20 kind of components that somebody can use to grow their grit. Some of the grit is kind of just in our DNA. Like some of us kind of have part of what we're born with, and then there's also things that we've taken from our people that teach us, our role models in our life, especially when we're younger, and our caretakers. But there are ways, even as we get older and get an adult, and especially when we're established in our profession, that we can still grow our grit, or strengthen our grit, or develop grit that we feel maybe is not one of our strong points. So some of the things that I want to talk about and just kind of point out these 20 things is look at these as ways to consider what I need to do to maybe improve my grit. First one is passion, and the first thing about that is just knowing what gets you motivated, what matches with your values, or what lights you up, and what gets you wanting to move forward. This is going to be the thing that motivates me to put the effort that I'm asking myself if I want to develop grit to commit to. And then second one's obviously having committed to commitment, and that's that fortitude, the stick-to-itness, which is not really easy, because when challenges come, sometimes it's easy to bail and sometimes it's easy to jump out. But the idea is, part of it is that ability to commit. Like, this is something that lights me up and I want to stick with it. And then giving concentration and attention to whatever this goal is. I think a lot of times we get busy. We've talked about, I think what I like about this grit and resiliency, because it'll bring in all components of the previous 8 weeks into this discussion. We need to be able to be successful in developing grit. We have to be able to concentrate and have attention to whatever it is our goal is. And so this is about that time management. It's like, I need to be able to set things for this. Gets my attention, and concentrated attention, not just like, yeah, it's there, but involved and invested in putting out other distractions. Having a vision, keeping an eye on the goal, taking responsibility for it. I mean, one of the things about this is too, to develop grit, is it helps you kind of say, I'm in charge of the choices and actions I take for this. It's my thing. I can't expect other people to do it, or blame other things for not being successful. I got to look at what is my self-responsibility into whatever I'm trying to achieve. Being optimistic, I think that's a huge thing. When we live in I think about it all the time. We're in a very pessimistic sometimes time, where everything's kind of negative, or what's the fault, is trying to develop optimism and drowning out critical voices, either externally or internally, to move forward. Giving the time sufficient to devote to this, your goal, being patient. I think that's sometimes a virtue that gets lost a little bit in our modern times, is that anything that's worthwhile takes time. Every one of you guys know that, because you've achieved success in your life, and it didn't come overnight. You had to work for it. But I think we can lose that. I think it's something we have to practice, a skill that we have to be with. And I think sometimes we can get lost in the shuffle, especially when we're stuck in our work worlds and we have all these expectations of productivity and demands and, nodes and insurance companies that deal with all this stuff. We just we lose patience. We just want things done, and being able to kind of step back and be patient with something. And if it's something that's worthwhile to be successful at, don't let the things drown me from being able to commit to that effort, and be patient with the process. Obviously giving effort, having self-discipline. I think there's a philosopher, Ken Keyes, that says the secret of life is sticking with it. And I think that speaks a lot to what we'll deal with when we talk about resiliency, is being able to stick with something even when it's challenging. Having courage, courage. I think courage is one of those things, being willing to face things that are uncomfortable. Somebody told me that's about therapy one time, is what it is about learning how to be comfortable with being uncomfortable. And I've always thought that was funny, but I think that's true. When we grow is when we learn how to be, and how we develop courage and strength is when we deal with things that make us uncomfortable and make us fearful, and stick with it and face it, and have that courage to see what happens. And we might have struggles and it might be difficult, but we're going to move through it. Developing habits that create ways to develop new goals. We get stuck in bad habits. So part of the thing is we can get stuck into good habits or new habits, especially when we have something we're trying to develop, grit or perseverance for, is like, what is this new goal? And what are the things and habits I need to develop in my life to be able to commit to that? Obviously getting support, getting role models, getting mentors, getting teachers that can kind of help with this new kind of, especially if I have somebody that I see has that perseverance that I would like to have and drive. What do they do? What are their actions? What are their behaviors? What are the tools that they use to be able to be successful? Obviously, creativity is a huge thing. Opening your imagination. We'll talk a little bit more about that later, but creativity is important for grit because it gives you opportunities to explore new things that make you want to have that drive. Stay loyal to your goals, have perseverance, being consistent. These are all the kind of things that we kind of talked about already. Then having that resilience, which we'll spend more time in the next part of this presentation on. Being open to feedback and new ideas, especially if you get from, you develop these mentors and support systems in place to hear what they're saying, and developing, purpose and meaning. Things that I'm going to get involved, that I'm going to try to commit to, that I'm going to put this effort into, that's going to evolve my life. I think one of the things we'll talk about when we do resilience is that this huge importance of this self-awareness, self-insight, into being able to take when I have challenges, is where can I grow from them? How can I flip my challenges from being the negatives, the pessimism, the things that demotivate me, and say, what do I learn from that? Where can I grow from that? And I think having grit helps to be able to do that, because I'm going to have to face challenges and I'm going to have to go through some rough parts, and it's not going to be smooth. I like the word grit because grit itself, the word, sounds uncomfortable, and that's the thing, is it's going to be uncomfortable. It's going to be bumps, but I want to be able to grow and evolve from this and commit to this. So being willing to go through some of those bumps to get there. So we'll bounce to resiliency and just kind of define what that is, right? And it's the ability to develop constructive adaptations to adversity and traumatic experiences. So it's not to avoid them, it's learning to adapt to the challenges that we face, and do it in a constructive way, in a positive way. I mean, we can adapt to something that sometimes are not always positive, and I think most of us probably had experiences where we had some sort of adversity or something difficult that we dealt with, and it didn't respond the way we'd hoped we would. And this is a kind of being able to develop ways that are constructive adaptations of positive things. Where can I, resiliency is something that helps me bounce back. Individuals can, earn resilience through experience and hardships. So I think one of the things about what we're talking about is not avoiding problems, but learning from them and diving into what these hardships teach me, in particular by developing qualities that facilitate appropriate coping skills, adaptations, and recovery from stress. I mean, the whole goal, hopefully, is when you face something difficult, is to be able to learn from and get new skills and new tools, and the ability for an individual to maintain personal and social stability despite adversity. That despite my challenges, despite the difficulty I'm facing, I'm going to be able to, adapt, deal with, and stay functional to the things that I'm responsible for. So, when speaking of physicians, physicians who are more aware of their mental and physical state fostered resilience through activities such as practicing personal reflection, being mindful of their stress level. So I think these are things that we talked about in the first two sessions. We talked about practicing mindfulness, practicing meditation. This is, I don't know that I expressed it in the first few sessions, but the idea of like mindfulness and meditation is that those are exercises for the brain. Like we exercise our body, we need to spend the time for exercise for the brain. Hopefully that's something that we can adapt. I'm hoping that's something not only that as people that work in the healthcare industry will do, but anybody does, because we've learned that physical exercises benefit us. Why wouldn't mental exercise benefit us? So being mindful of the stress level, reactivity, and the impact of the past life events on present day functioning, which is a big thing. We talked about that last week with counseling, is being able to see how have my past, the things that I've learned and adapted into, caused me to respond in certain ways, and what can I learn from that, and what can I make adjustments from it? Because some of the reasons why we struggle with bouncing back is because of what our past and our unconscious mind has kind of taught us. And recognizing when personal and professional changes are needed. And I think that's a huge one, being open to feedback, being open to others' perspectives, knowing when change needs to happen, and facing change. It's challenging because most of us don't like change until we get comfortable in things. But again, we're going back to these words, grit and resiliency, that it's okay to have change, and I will be able to get back. It is difficult. It's already pre-acknowledged. But where can I go, and what can I grow from it? What may be the new hopes that come from making change? Research physicians in Canada identified 4 dynamic elements for building resilience, and that was attitudes and perspectives, balance and prioritization. So we're talking a little bit about counseling. We're talking a little bit about time management, practice management. Talking about boundaries and involvement with others, and supportive relationships, which we're talking about that kind of wellness that goes on beyond just our work environment, but the wellness we have in our family, our friends, and the other activities we do, if it's being involved in clubs or sports or something like that, or being able to develop and nurture that stuff. If people want to be able to develop resiliency, they need to focus on those 4 dynamic elements. So I'm going to show a video real quick. This is Dr. Amit Sood from the Mayo Clinic. He is the kind of guy in charge of the resiliency program for physicians up there. And this is a 2 or 3 minute video that'll talk a little bit about how people develop resiliency, or how physicians specifically develop resiliency. Even at the end of this presentation, I have another video that he has put together that talks again about how we evolve resiliency. It's an animated one. It's a little bit more lighthearted and fun to kind of watch. So we'll first start with this video, and he'll share a little bit of his perspective and experience.
Full of stressors, but not every stressor translates into stress. There are really three characteristics of a stressor that convert them into a feeling of stress. One of them is demand-resource imbalance. Whenever you're perceiving that you have excessive demand and you're not able to meet that demand, you feel stressed. The second is lack of control. When things are in your control, you feel good about it. But when things are out of control, then you feel excessive stress. And finally is lack of meaning. If you hear somebody has lost a unit of blood, it doesn't sound good, but if they donated it, it is not as stressful. So it is demand-resource imbalance, lack of control, and lack of meaning that makes us stressed.
That's very insightful. Now, are we as physicians condemned to a life of stress, or are there things that we can do about this proactively?
Oh, we can absolutely do a lot about stress, and that is by cultivating what we call resilience. Resilience is your ability to withstand adversity, bounce back from adversity, and prevent and preempt adversity. Resilience has multiple characteristics. One of them is cognitive resilience, which is your ability to maintain attention, judgment, and decision making in the midst of a stressful situation. Second is physical resilience, which is your ability to maintain health and well-being. Then is emotional resilience, which is your ability to have a balanced, optimistic disposition through your life. And finally is spiritual resilience, which is keeping a higher meaning and altruistic perspective. So when we cultivate all these characteristics within us, we develop resilience.
So Amit, how do we actually cultivate these four important things you've mentioned? Is it possible to train for them, or tell us about the program you've set up here at Mayo in resiliency training?
Sure. We have a stress management and resilience training program where we help people learn, first of all, about their brain and mind, why our brain and mind that have a threat superiority effect, our instinct to pay attention to imperfections in life, why that generates a lot of stress. Based on that understanding, we help participants first train their attention so that they are more in the present moment, not lost as much in past and future. A lot of stress comes from us dwelling too much on past and future. So training attention is a key aspect, and I believe the first step towards developing resilience. Then we help them refine their interpretations using some of the higher principles. The core principles we have in our program are gratitude, compassion, acceptance, higher meaning, and forgiveness. So these two components, training our attention and refining interpretations together, help people be resilient. We have done several empirical studies to test our model and found that the intervention does enhance people's resilience.
So I think there's a lot of good things that came out of Dr. Sood's video there that he talks about the resilience. Where does stress come from? How does it evolve? And how are ways that we can develop resilience to let our make sure stress doesn't impact our lives. One of the things I really thought was powerful in it when he talked about at the end there. I'm drawing a blank. It's the perspective of how we get lost in past and future thought and how that creates stress. And I've been a counselor for a long time doing this stuff, and I think that's working with people, and that's been the thing I hear most of the time, where people are usually stuck with either a past scenario that's causing them to feel regret or feel sadness or feel like I wish I could do, getting into like wishful thinking that is something that won't, they can only do something about not doing it again, but can't change what the past has happened. Or getting stuck in the future, projecting or thinking ahead or thinking they have that crystal ball that knows all the answers to the situation, or they already know what the result's going to be before it even occurs, and it creates so much anxiety. And I tend to think why it's a simplification and it's not clinically founded in the DSM, but I tend to think a lot of depression comes from that the regret of the past, and a lot of anxiety comes from our feelings of anxiety or projections about the future. And really what we've talked about through this whole series is how do I stay in the now, how to be mindful, and how do I develop things to not get lost. And I think that's part of what resiliency is. I put a link at the end of this. They'll talk a little bit more about Dr. Sood's program up at the Mayo Clinic if anybody wants to just learn more about it. But I think that there's some valuable things that are like just from watching kind of some of his short videos that it can take with us. I'm going to kind of share it with you, just a little thing that I found when I was doing some of my research that I thought was a fun little resilience exercise, in the sense that here are things that here's some identifiable things that kind of spell out the word resilience that I can keep in perspective as I'm trying to evolve this, as I'm trying to evolve and work on my grit and work on my resilience. Here's some things I got to keep in mind, or my back pocket, or tools that I need that I can hopefully utilize as I'm trying to evolve my skill and resilience and my ability to bounce back from complicated or difficult situations and grow from them. Not just bounce back, but grow from them. Obviously, the first one, and we've talked about it a little bit in some of the other areas, is relationships. And I think relationships is a dual area. It's not only about getting support for the relationships and the positive places that we need to get it from, but it's also about getting in relationships that we're giving back or being transcendent to others, getting volunteering or getting involved with like social activities that allow us to give, so it's to be also get nurtured, but also to nurture, giving everyday effort, setting realistic goals for every day and feeling like you have ways to accomplish, creating positive thinking. I think that's one of the things we do is like create small goals that are attainable. And that way, at the end of the day, we feel successful. Sometimes we get lost in the big picture and we can't see the movement we've made within the day to get to that. And we're just like, I'm not there yet, so therefore I'm lost, or I haven't, you get demotivated. And being able to hopefully look at small goals and see how you're crawling towards that direction you want to go. Be open to self-discovery, see what you've learned from difficult situations. Focus on what you've gained from something that's been hard. sometimes go through difficult or tragic or complicated situations, it feels like we're just losing. But sometimes what happens in something like that is we're also gaining something, and being able to be willing to self-discover even when it's difficult. Having perspective, being able to see the forest, not just the tree. Don't just focus on the problem, but see the bigger picture to a situation. Life could bring, the L's, life could bring you good things. Expect them to. Be optimistic. I mean, sometimes we sometimes have this thing where we get stuck, and I talked about it in the last thing when in the video address. It's like we get this thing where we already know what's going to happen, so we kind of start giving up or we have a bad attitude. So being able to stay positive, like, optimistic that something positive is going to come our way. I'm with my significant other. She's exploring other work opportunities, and she's done some things, set some resumes in, and she's always like, oh, they're not going to give me the interview. And it's like that kind of setup is like, then, you're putting yourself in a place where it's like you kind of beat yourself down, where you almost think that you're not worth getting the next opportunity. Talking about in caring for yourself, being able to take care of your needs, both mind and body. We'll talk a little bit on the next slide about that, but being able to set the time, take care of your brain, take care of your physicality, exercising, walking, being active, meditating, doing readings that are positive, that flourish your thought, doing exercises that flourish your thought, puzzles, things like that, to kind of keep your brain active in a way that isn't just what we do on the day-to-day basis, but things that will open up those new pathways up there. Don't get stuck in end of the world kind of thinking, that sometimes we feel like we can get negative, that this is just not going to work out, this could be a bad situation, and being able to say, no, it could be, it might be good. I like this quote from Viktor Franklin. He's the creator of logotherapy, which is the kind of concept of the pursuit of meaning in one's life, kind of therapy. And the last of human freedoms is the ability to choose one's attitude in a given set of circumstances. I think that's a pretty powerful statement, right? That is a true freedom we have, is to be able to see how we choose to respond to difficult situations. Nurture a positive view of yourself, self-nurturing. Changes are inevitable, just to embrace them instead of avoiding change, embracing change. I think sometimes situations that are difficult, if we just stepped into them thinking like, okay, I know it's going to be a change, so let's see what happens, let's be excited about it. Maybe it wouldn't feel as overwhelming. We wouldn't feel those feelings inside, those internal like stressors, feeling tight, overwhelmed, those kind of things. If we kind of looked at it, the perspective of change differently, and finding encouragements and taking action. And the idea is that moving forward, even small, is good and it's positive. Just a couple other tools that to consider and think about, right? Find a mentor, somebody that you look up to. And I don't think, I think it's helpful if you get somebody in your own profession that's a mentor. I apologize if you hear noise over this, where there's construction in the rooms next to us. And find a mentor, somebody that, it could be a physician that obviously you've seen success, but it could be anybody in life that you feel like is successful in being able to deal with adversity and being able to kind of learn from them. Obviously, we talked about meditating and mindfulness. We've spent presentations on that. Being able to keep a good sense of humor, being able to be happy, be positive, be able to laugh at stuff, even laugh when things are difficult. Nurture self-esteem, nurture creativity. I think this is a huge one. Open up new, either revisit pathways that we've kind of put aside and haven't been able, to have time for. If it's like art, photography, music, whatever it might be, make time for that. Or if we're engaged, commit, continue to do that stuff to flourish and keep those pathways open. Or take on a new challenge, like, hey, I've never played a musical instrument. Do something like that, where it challenges to open up new pathways in the brain, and it allows the brain to evolve even more. Obviously, exercise and make peace with your past. I mean, that's part of what we've talked about here in this presentation. A lot of the presentations is being able to, get peace with your past. Don't let those past roadblocks be your current obstacles. And utilize counseling if need be to address that, or get some sort of therapeutic support or ability to get insight. So I'll show one more video. It's just a couple of minutes. I think it's a nice little animated piece about resiliency. And then hopefully we can open up, and if there's any questions or anybody wants to discuss, I'm always more interested in how you guys have dealt with and had experiences in dealing with, grit and resiliency, and what you guys have done, and share with each other your own personal perspectives of how you've been able to overcome difficult situations than anything. I'm kind of just sharing some basics. There's some resources at the end of the PowerPoint you guys can look at or tap into if you want to. But I think one of the parts of doing this exercise is to be able to bounce back personal experiences from each other with each other, since you guys are living it day to day. So let me play this last video.
Since the early 1900s, many scientists opine that some phenomena don't follow a straight line. With no pressure, no challenge, life gets to be boring. We wander into distractions, find ourselves snoring. Excessive load and pressure, however, isn't what I desire. They hurt my back and morale and douse the creative fire. I need challenge, I need pressure that is just about right, so I don't get bored and jaded, nor weary or too tight. With 50 user IDs to remember, a question my mind asks: how do I deal with daily deadlines? Little control, countless undone tasks. Each day is a struggle, I'm barely getting by. I risk burnout and illness, even an early goodbye. Prioritize, simplify, delegate, better manage your day. To lower my stress, that is certainly one way. Is there anything else I can do since little is left to snip? Can't I bolster my strength so nothing I need to clip? I indeed have another option to lift my every experience. That option is to smartly choose a life of resilience. Resilience trains my brain. Resilience helps my intention to enhance my creativity, positivity, and attention. With resilience, I bounce back faster, better heal my pain. I'm happier, more productive, get more mileage from my brain. Friends, resilience is your inner strength that helps you withstand and bounce back from adversity, as well as prevent and grow from life's hardships. Your happiness and resilience depends on 3 key factors. Number 1, your genes. Number 2, your life situation. And number 3, the choices you make. While you can't pick your genes and have limited control over your life situations, you can choose your thoughts, words, and actions that help you be more resilient. Self-awareness, authentic presence, a can-do attitude, gratitude, compassion, acceptance, nurturing relationships, finding deeper meaning, and a spiritual anchor. These are the 9 pillars that support your resilience. For more information about resilient living, check out stressfree.org.
So, this is I think it's just a fun little video to kind of be able to play there at the end to kind of encourage, us to be able to, just reach out and work on this kind of these skills of grit and resilience. Some of this is about who we are and our DNA that we brought in. Some of this reasons we struggle or have strength in these areas because of what we've been taught and trained. Some of it's about our choices, and I like that part of the video. That's the part we have a lot of ability to do something with, is our choices. And so, I just encourage you to, consider some of the things that we talked about here as things to kind of take as tools or recognize strength in myself, or we've talked about over the last 8 weeks. I think the next 2 weeks I'll probably have, or next 2 months we'll have guest speakers talking about the exercise and the nutrition, and I'll probably get back with you guys at the gratitude one. So anyhow, I'm going to put the resource screen up there so you guys can see that way if there's any questions that are coming about in the next few minutes. Caitlin and Kate, take it from there.
Alrighty. Well, I am moving everybody over. So if you have video and want to be seen, or if you have questions, please unmute yourself and you can ask a question. We also wanted to call attention to this last resource here, the 8-question grittiness survey. It might be a good place to start to kind of figure out your score for your grittiness and how grit you currently are.
Yes, all right.
Let's see. I think there's one more. Anyone have any questions or a story to share? Okay.
I mean, I know sometimes it's kind of difficult when the video maybe setting to feel like it can intervene, but definitely open to hearing anybody's experience of how they've tried to develop any resilience or grit, or any questions about this stuff. I mean, some of it's kind of self-explanatory, but I think it's a little bit more about how do I get to places, and maybe we can talk about that.
Nelson, I'd venture to say that most physicians are probably inherently pretty gritty.
Yeah.
They've gotten through medical school, they've accomplished all their residency training, and now they're in the thick of patient care.
Sure.
Any good advice for maybe our resident members who are really feeling it, or even students and residents that might be feeling this for the first time at a huge rate that they can carry with them through their practicing years?
Sure. Well, I think it's a great question. And I think that for people, I mean, you're absolutely right. I think somebody gets to the place where they have, become a physician, they go through a lot of difficult scenarios, and they must obviously have some level of grit to be able to kind of get through that, because it's not an easy task by any stretch of the imaginations. The more and more I'm a physician, the more and more I see the challenges that come with that. But I think can be overwhelming. I think one of the things that, we've talked about a little bit in some of our past presentations is there's such an expectation sometimes for perfection and to be, to push yourself to these levels and not sometimes, put your needs secondary. And I think one of the things that we talk about here is being able to, don't do that. To some degree, put some of these needs, make time for yourself, and do some self-care. So we're talking about resiliency. Resiliency is this ability to bounce back from difficult situations. Well, inevitably that's going to happen. And sometimes people just, if something bad happens and I'll just kind of it happened, I'm just going to deal with it, ignore it, and not actually address the situation and learn from it. And then find myself repeating, kind of going into difficult, why is this continuing to happen? Why am I running into this roadblock again and again? Especially when you're taking on a new task. I mean, it's going to be inevitable. You're going to run into some difficulties and challenges. And being able to sit there and explore those. I think that's what resiliency, at least, kind of what I'm learned and what I've taught with others is the ability is to learn from that opportunity. And what is there, don't just push it aside, or I just got through it or whatever, but where's the place for inner growth, and take time for that. I think one of the ways I think it talks about here is know from the get-go, what are your strengths and what are your I don't know the right words, weaknesses or things that you can build on. How take that quiz. How gritty am I? Is this going to be, am I able to take bumpy situations well, or do I have a lot of evidence that way I kind of perceive and see things, that this might be difficult, that I might take on stuff. But one of the things I think people do is I can do stuff at work and I can put on the persona, but then I take some of that negativity or some of the challenges home, and it has an effect on my personal world, even though I can put on the show in my professional world. And being able to say resiliency and being able to bounce back is not just about being able to bounce back and put on a good show at work. It's being able to bounce back and be able to not affect not only your professional world, but your social world and your private world, and being able to accomplish that. So I guess for me, one of the things I would say is take time to get to know where you're at, where you're coming from, if that's through talking with a mentor and their experience, or if that's talking to a professional through the experiences, or taking some, doing some readings about grit, about resiliency, about what evolves it, what's my life experience that told me about those things. And be honest with myself. I think one of the hard parts about knowing where we need to grow is knowing that we might have things that we need to grow from. And some of us want to hold on to that we get in denial about things because we don't want to look at the uncomfortable parts of ourselves. And I would invite saying we grow from looking at that. So I don't know if that kind of helped, but those would be some suggestions I would have. Definitely tap into the mentor and resources. Tap into. I mean, most places I know when I work with residents, they have self-care stuff set up, and I don't know all the time that it gets maximized by people that are in those positions.
Are there any other questions, or maybe a physician would like to share a personal story about how they were able to overcome a situation and dig into their grittiness and maybe share a story of resiliency? I think also it'd be important to mention that the American Academy of Family Physicians recently released an entire campaign on physician wellness and resiliency. It can be found on the AFP website, and also it was a feature in yesterday's Family Medicine Update newsletter, but it's called Physician Health First, and it's a great resource for physicians looking for interesting articles, for QA areas where they can measure themselves against their peers. It also gives a really good outline of what is being done to try to change the system and the environment in which physicians are practicing currently. Try to alleviate some of the administrative burdens that are also causing the issues for burnout and causing physicians to have to dig deep to try to overcome those barriers. So if you have a chance, on top of all these great resources, check out the new Physician Health First campaign from the AFP.
I think you bring up a great point, Kate, too. So, we're working on some projects to help physician wellness and resiliency, as far as trying to reach, physicians individually. And there are two components. There's the individual kind of component of the stress and burnout that's kind of occurring and why we need to do, resilience and wellness training. And then there's the systematic part, and I think we spend a lot of time, talking about the individual stuff, but there is definitely a need to address the systematic things that go on there that create the environment. And those are bigger conversations. Those are more difficult conversations. And I think that's why some of this stuff is designed individually, because this is stuff we can empower ourselves to do. But there are some things that most definitely need to be changed. They're causing part of the problem. And I think it's being acknowledged more and more by systems, but it's difficult to make those changes, I think, overnight for some places.
Well, Kate, thank you for pointing out the obvious, that doctors have had a lot of grit to survive college, medical school, residency, okay? This is probably a little bit of like preaching to the choir.
Yeah.
Okay, but I think that the most important thing of this session is to make the resources available for people that need some guidance when they feel lost. Okay, so I'm pretty sure that the people that have participated here, they have grit, they have resources, they're survivors. Okay, and this is just one more option to provide to our patients, not only to ourselves or our colleagues.
Absolutely, yeah, and I think you're absolutely right. Like, I think most people here, I think people that are coming to this program tend to be people that are probably having are interested in their kind of the self-care and developing the skills that they need to create their strengthen the grit that they already have, or to build on that resiliency that they've already established and some of the skills they have. You're right. How do we get to the people that may not, necessarily have that may be a little bit more timid to get here? And that's one of the things we're trying to. I know as an organization, I know that the OAFP is trying to work on it too. Is how do we get this stuff out to people that may not necessarily be able to get or aren't reaching out as much as some other people are. And it's one of the ways that we're trying to develop some internal systems to provide that service. It's difficult though, because a lot of times when people are struggling, that's when it's most difficult for them to reach out. So I appreciate that feedback. Thank you.
How about facilitating balanced groups like we had in the residency program? But it really has to be at a regional level.
Yeah, and you're absolutely right. And I think that is actually a conversation I was just having yesterday with our director here and our medical director, as well as we're reaching out to some of the regional areas. We actually talking to some people up in the Northeast and Cincinnati area. People are doing some physician wellness resiliency stuff and trying to create systems where people can reach out to get these services and do things like groups. I think groups is a critical piece. So we were actually talking about, do we need to start developing groups and be able to offer them? And is that, for us, we're in the central part of the state, but how will we adapt it to the, other regions of the state that obviously have, big populations that need to get this addressed? And so we're looking at that. I mean, we actually started some groundwork just yesterday discussing that, or hopefully we can put something together to start out where we can start out, probably central first, but to see what it's like. And we offer wellness and resiliency group services, not only that educate, but also give the opportunity to talk and process, and do that with trained therapists that work with physicians on a regular basis. So that's absolutely what we're looking at, absolutely what's needed, and we are discussing it with several hospital systems, both bigger systems and smaller systems, about how that's going to happen. We're actually working on an online EAP system that would be able to address physician needs in by telecommunication, but then it would be the challenge of how do we do that group-wise, because that is one of the bigger things. And how do we, so it's in discussion, there are thoughts happening, we're hoping to see some changes and things being introduced next year. So
probably it would be worthwhile to consider both something like online that would be easy to do from home or from the office at lunchtime, and then also maybe some personal meetings, but that would be much harder to organize.
Yeah, you're right. The online is where a lot of people want to find things happening at, and that's where a lot of the looking at the discussions on that. It's one thing that I think that's going to be the challenge. Even for me, I've been counseling a long time, but one-on-one online, I know how it's pretty simple. We've got two screens, bringing the whole group and having that whole group dynamic, or that's going to be something. But I think that's something we have to look at, because physicians are busy and they have busy schedules, and how do we find things that accommodate schedules that work, get people there, and get the service met. So it's there, that we're actually vetting a bunch of online services right now to address that. So I appreciate the idea, because it sounds like that what I'm hearing is that's something that needs to happen, and I'm glad that we're trying to aim in that direction. Did we lose everybody, Kate, or?
Will the links be available on the website?
Yeah, I'm actually gonna give the actual links to Kate right when I get done with this, and she can put those up on the website. Well, I don't know. I don't know if she does it on Monday or when she does it, but I give her those resources.
Okay, thanks.